Hello, I'm Dr. Andrew Van Treese. I'm the author of the book, How to Be a Winner, a lifestyle guide to achieving and maintaining health, and I practice brain-based therapy. Today I'm going to talk to you about fibromyalgia. Fibromyalgia is a disorder that affects almost 15 million Americans. But what is it? By definition, it is pain in the muscles and the connective tissue surrounding the muscles, ligaments, and tendons. Now typically, the fibromyalgia sufferer experiences pain throughout their body. They have fatigue, lack of energy, the kind of exhaustion that resembles the flu or extreme lack of sleep. In addition, complaints of abdominal pain, bloating, alternating constipation and diarrhea, migraine headaches or tension headaches, frequency of urination, skin and circulation temperature sensitivity, and difficulty thinking labeled brain fog are common in patients with fibromyalgia. Now, it's been my clinical observation that many fibromyalgia sufferers have experienced some severe stress in their life. Sexual abuse, physical abuse, verbal, emotional abuse, financial stress, or all the above. The tricky part with fibromyalgia is that it cannot be diagnosed by any lab finding. The diagnosis depends mostly on a person's complaints and their feelings. Now, currently, a majority of the medical profession states that a patient must have 11 of 18 points on their body to be diagnosed. But what if you only have 8 and you still feel lousy? What then? Are you not a fibromyalgia sufferer? To me, fibromyalgia is far too complex and cannot be revealed with such a limiting diagnostic tool as 11 of 18 trigger points. So what is the true cause of fibromyalgia? In every case of fibromyalgia I have treated, I have found a high mesencephalic output. Now, there are 3 parts to the brainstem: the pons, the medulla, and the mesencephalon. 90% of your cortical output, that's your brain output, travels to the lower brainstem. When the brain is functioning properly, this stimulation suppresses the mesencephalon. However, if we lose this brain loop and the mesencephalon is allowed to fire at a much higher rate than it should, we're going to experience fibromyalgia. So with brain-based therapy, I do a complete neurological examination to determine which part of the brain and the nervous system is not functioning properly. And then I treat it, thereby treating the true cause of your fibromyalgia. We do this with fuel and activation. The brain and the nervous system need 2 things to thrive: fuel and activation. Fuel comes in the form of oxygen and glucose. Activation comes in the form of the therapies that we provide at this office. I'd like you to watch the introduction to brain-based therapy on the home page of our website. And there you can hear more about BBT and the therapies that we use at our office to increase activation to the dysfunctional areas of the brain. I look forward to answering any questions you may have. I look forward to working with you. I look forward to eliminating your fibromyalgia so that you can experience the life that you deserve. Thank you.